Welcome to cGMP Fundamentals, focusing on Subpart D equipment. Our agenda for this video includes an introduction to Subpart D, a discussion of key CFR requirements, practical applications, and a summary of FDA citations. Your instructor, Sam Pandit of GMP Scientific Inc., brings over 40 years of experience in regulatory compliance and pharmaceutical quality assurance. Subpart D, specifically 21 CFR 211.63 through 72, mandates the minimum requirements for controlling and operating manufacturing equipment in the pharmaceutical industry. Section 211.63 covers equipment design, size, and location. Equipment must have an appropriate design, be of adequate size, and be located to facilitate operations, cleaning, and maintenance. Section 211.65a dictates that equipment construction materials should not be reactive, additive, or absorptive to prevent alteration of the drug product. Section 211.65b addresses components like lubricants and coolants, requiring that they do not contaminate the drug product or its components. Section 211.67a requires that equipment be cleaned, maintained, and sanitized at appropriate intervals to prevent contamination. Section 211.67b mandates written procedures for equipment cleaning and maintenance. These procedures must detail assigned responsibilities, define schedules, and approved methods for cleaning, disassembly, and reassembly. Further requirements under 211.67 include removing previous batch identification, protecting clean equipment, and inspecting equipment before use. Section 211.68 covers automatic, mechanical, and electronic equipment. This equipment may be used, but must be routinely calibrated and checked, with written records maintained. Automated equipment requires appropriate controls, including changes approved by authorized personnel. Input, output, and formulas must be checked for accuracy and verified based on complexity. It is necessary to maintain a backup data file, with some exceptions. Written records, hard copies, or alternative systems must assure that backup data is exact, complete, and secure. Compliant automated equipment can replace the requirement for independent checks by a second person. However, a single person must still verify that the equipment correctly performed the operation. Section 211.72 specifies that filters must not release fibers. Where necessary, an additional non-fiber releasing filter must be used. In practical applications, always follow your firm's procedures, apply cGMP correctly, seek guidance when unsure, report non-compliance, and involve the quality control unit. Common FDA citations include not considering worst-case conditions for validations, failure to investigate cleaning failures, using obsolete maintenance procedures, lack of validated clean hold times, and missing maintenance records. Other common citations include inadequate equipment qualification records, lack of residue testing data for cleaning verification, missing equipment use records, unverified filter integrity, and the absence of written calibration procedures. To recap, we covered the overview of Subpart D equipment, focusing on design, construction, location, cleaning, maintenance, sanitization, automated controls, filters, and how the subpart affects various functions, including common FDA citations. For your next steps, we encourage you to dive into the details, take the quiz, and consider additional related topics. Thank you for watching this video. You can reach out to us via email, social media, or phone using the contact information displayed.